Hello, my friend, and welcome. I'm thrilled today to have a colleague and friend, Dr. Sarah Stombaugh, on the podcast today. Dr. Stombaugh is a family medicine physician and obesity medicine doctor. She has clinical work. She has a brick and mortar clinic, so you can actually go see her in Charlottesville, Virginia. But she also serves people by telemedicine in Tennessee, Illinois, as well as Virginia. In addition to her work helping people with obesity, she is the host of the Conquer Your Weight podcast. And through this platform, she shares valuable insights, expert opinions, and practical advice on weight management. Welcome, Sarah.
Yes, thank you so much for having me. I'm really excited for our conversation today.
Would you please just introduce yourself a little bit to the audience, tell a little bit more about how you got into this work?
Yes, absolutely. As you said, I'm a family medicine physician by training, and I also do obesity medicine. And this has really been a longstanding passion of mine. A big part of why I went into medicine in the first place was to be able to understand and then help treat obesity. I grew up in the rural Midwest. We have a lot of obesity in my family, and then certainly in the community that I grew up in. And I never felt that I understood it or that there was really much great advice being given out. And so as I went through my medical training, trying to understand that, went into family medicine is really a great way to be able to support patients in a preventative and comprehensive way. And then felt that I still didn't have answers to those questions. And so went and also became certified in obesity medicine. And so I've been practicing this as part of my training, even sort of through family medicine and then into my career. Over the last couple of years, I've transitioned just into obesity medicine care. And I really love supporting my patients with a comprehensive approach to their obesity. We're thinking about medical support for it, things like some of the newer popular medications, but then also thinking about what are we doing from a nutrition standpoint, from a movement standpoint, with stress, sleep management. I'm a coach as well. And so really helping to support my patients of not just what you should do, but in the day-to-day when you're busy or you're on vacation or, navigating different life changes, how do we manage and support those? And so I love to support my patients with all of these different tools. And so I'm grateful to be here today, and I try to get my message out on just every platform. I'm on TikTok and Instagram and my own podcast, as you mentioned, and try to be a good source of information for these things.
Excellent. Thank you. Today, we're going to talk about these newer, more popular medications that are just all the buzz. Everyone's talking about who should take them, who shouldn't take them,
Mhm.
work. So let's dive in. Tell us a little bit more. I mean, we know some of the names, right? Wegovy, Mounjaro, Ozempic. Tell us a little bit more what these medicines are and how they work, please.
Absolutely. So, broadly, we're talking about the GLP-1 receptor agonist, although this also includes the GLP and GIP medications. When we look at this whole class of medications, it actually goes back about 20 years now. When we look at some of the first medications used for the treatment of type 2 diabetes, there was a medication called Byetta. This was an injection that was actually taken twice per day. And over the last couple of decades, we've seen the evolution of these medications into once daily medications, and then in the last decade to once weekly medications. So the ones that everyone are talking about now, the Ozempic, Wegovy, Zepbound, Mounjaro, those are all weekly medications used for either the treatment of type 2 diabetes or now for the treatment of weight management. As I said, they've been used for diabetes for the last 2 decades, but we found that some of the underlying metabolic factors that contribute to diabetes are really some of the same factors that contribute to overweight and obesity. And so we've seen that these medications can be very effective for a weight standpoint as well. And so medications like Ozempic, for example, that was the first of all of these medications that was approved about 7, I guess coming up on 8 years ago now. And that was approved for the treatment of type 2 diabetes. That's a semaglutide product. The exact same medication, Wegovy, is indicated for the treatment of obesity. Similarly, a few years ago, we saw Mounjaro FDA approved for the treatment of type 2 diabetes. That's a tirzepatide medication. And then the exact same medication, Zepbound, also tirzepatide, exact same as Mounjaro, approved for the treatment of weight management. So we see these same medications being used for these indications. And there's a reason they're so popular. They can be very effective for the support of weight.
And tell us a little bit more about how they work, please.
Yeah, absolutely. So the GLP medications, when we think about the GLP receptor, we have those located throughout our body, but primarily in our gastrointestinal system and in our brain. These are receptor agonists, meaning that they stimulate that receptor to make it basically more active or perceive that it's being activated. And so they play a major role in the release of insulin after our mealtime, as well as in our hunger and satiety pathways, which is really part of the gut brain axis. So a lot of hormones that are signaling or released from the gut, such as GLP, then signal within the brain to signal hunger and satiety. And so that's a big part of how GLP works. And so we see the effect in the gastrointestinal system. We see improvements in blood sugar. We see a slowing down of digestion of food, for example, sometimes related to the side effects that we see from these medications. But then in terms of how they trigger in our brain, patients feeling more satiety, feeling that they're not as hungry. And then you'll hear a lot of people describing things like decreased appetite, decreased food cravings, especially that food noise is often described as. There's a second receptor called GIP. This is the gastric inhibitory peptide, and this is a second receptor that is in the Mounjaro and Zepbound medication. I like to describe it as having a synergistic effect with the GLP. It works in slightly different ways, primarily targeting in some of our fat tissues, really allowing for better release of our body to break down some of that fat, triggering in our gastrointestinal system as well. And so when we look at the effectiveness of these medications, the GLP GIP combination medications are a little bit more effective compared to the GLP medications alone.
Now, who would be an ideal client or an ideal person for these medications?
Excellent question. So, certainly, we know that patients with type 2 diabetes may be really good candidates. But when we think about these medications from a weight standpoint, these medications are FDA approved for the treatment of obesity. So, looking at a BMI of 30 or higher, or looking at a BMI of 27 or higher with a weight related comorbidity. So, that's things like high blood pressure, high cholesterol, prediabetes, fatty liver, arthritis, PCOS. Honestly, the list can go on and on. Many different conditions we know can be associated with weight, but those are the most traditional criteria. Interestingly, we've recently seen approvals for things like cardiovascular disease and sleep apnea as well, though the Wegovy medication has a secondary indication for people who have a history of cardiovascular disease in prevention of a secondary cardiovascular event. And then the Zepbound medication recently got approval for the treatment of moderate to severe sleep apnea in patients with a BMI of greater than 30. And this is really exciting because we've seen this evolution of how we as a medical community are understanding the diagnosis and then treatment of obesity beyond just weight itself and the effects that it has on other health conditions like heart disease and sleep apnea, for example.
Interesting. So most of the people listening are professional women who are perimenopause or they're through menopause and beyond. And they have different stories. For some of them, they have actually had difficulty with weight for most of their life, or maybe even just in adult life since having children. But they get to menopause and then there's a big bump in weight gain.
Mhm.
And then there's also a group that did pretty well and were in a pretty moderate range for weight and then get a lot of weight gain at menopause. Do you think about
Mhm.
people differently when you look at those two groups, when you're thinking about medications versus other choices?
I do. And so both of those patients may or may not make sense for medication depending on other factors. But sort of broadly speaking, when we look at someone who's dealt with chronic obesity, we know that obesity is a chronic disease. We know that having excess fat mass on our body can be this really difficult metabolic cycle to break. So we look at the role of fat, and sometimes we think of fat as this kind of like blob of tissue on our body. But the reality is, fat is actually very metabolically active. And with that metabolic activity, it can create things like insulin resistance, for example, like leptin resistance. So our body is driven to have higher blood sugars from insulin resistance. It's driven with leptin resistance that we don't feel satiety appropriately. And then when we try to lose weight, there can be this really big kickback effect of our body sort of feels like it's starving, and those hunger appetite signals can just go through the roof, and people feel ravenous after they've lost whatever amount of weight. So there can be this really cyclical thing that happens. And so for someone who has chronic metabolic disorder and has struggled with weight chronically, even if it's a weight cycling where they've gained weight, they've lost weight, they've gained weight, they've lost weight, medications like this can be really a phenomenal game changer to really just help to stabilize some of those underlying metabolic conditions and help them such that all of the things they've been trying to do all along with certain nutrition changes and movement changes really allow those things to take effect in the way that we would expect them to. And so someone who's had those chronic weight issues is going to be a really good candidate for this type of medication. And that's just one tool in the toolbox. So, the type of work that you do with your clients and thinking about nutrition and movement and why we make the decisions we do, why do we choose to eat? Is it based on our own bodies, based on the people around us, based on the time of the clock? All of these different factors play a role for us. And so, we know that there's also a major shift that happens during menopause by which our bodies may deal with things like insulin resistance, the hormonal changes of estrogen, progesterone, of testosterone, that those can play a role in the way that our body stores fat. A lot of times seeing fat that can come around the midsection. And there's a lot of lifestyle interventions that can be very effective for that, whether it is treatment for the underlying hormonal piece and supporting with hormone replacement therapy, where that's indicated and medically appropriate, or whether it's looking at what are the nutrition and movement pieces that can really support a woman who's in her perimenopausal years, looking at certain nutrition changes and particularly resistance training, that type of thing. So phenomenal. And so for a woman who's in her perimenopausal years who has not otherwise struggled with weight and is now starting to looking at, okay, what is happening from a lifestyle perspective? A lot of times as we're able to optimize that in and of itself can be phenomenal. But there's other women for whom maybe they were sort of on the cusp of metabolic disease before, seeing that their body is storing fat in a way that's more challenging. They've been doing some of these lifestyle interventions, eating in a way that's in line with their goals, moving their body regularly, doing resistance training, getting good quality of sleep. And they're like, oh my gosh, I'm doing it all. Sometimes it can make sense then to still use medications like these GLPs in order to support the weight loss goals. I think one of the things that's important for anyone is recognizing that it is one tool in the toolbox. And when we look at these treatments, they are really designed for long-term use. And so that's phenomenal if they're used in that way. And if there's a goal to come off of the medications, I believe very strongly that any patient, like, they're the boss of your own body, right? Like you get to decide what goes in your body. If you're going to stop a medication, I will fully support that and support any trial off of medication. But let's make sure we're optimizing all of the other pieces because there are patients for whom stopping the medication can really create significant weight gain. And so just understanding what role this tool might play and if layering it on makes sense, phenomenal, but it may be something that we're thinking about for a long-term period of time.
I love that you said that because as you sometimes read about how often people go off of it, and I am concerned about it being the new yo-yo. People don't look at all those different factors you talked about with lifestyle and everything else.
Exactly. And I think with that, with coming off of it, it does almost present this like, is it the new fad diet? And I think that these medications, when used sort of inappropriately, can be the new fad diet. And people are trying to lose as much weight as quickly as possible. They may not be as intentional about what their nutritional piece looks like or their movement piece. They lose a lot of weight quickly over 3 to 6 months, let's say, and stop the medication. And they've just set themselves up for kind of that same weight cycling that they've had from any number of diets in the past.
Sure. Most of the people that I work with are women who have decided they don't want to use medication. They really want to do lifestyle changes. So they come for coaching and nutrition support in my program. And a lot of them will have this story. I have a relative, I have a friend at work or something. And to me, it looks like they're just eating less. They're not really following any nutritional stuff. And so what's important there that has to go along with medication as far as lifestyle and nutrition?
Absolutely. So if you could imagine a program like yours where you're thinking about the nutrition piece, thinking about why we're fueling our body, when we're fueling our body, and really working to understanding some of those underlying factors, that is going to be one of the most important things in any long-term success, whether we are or are not using these medications. I do think there's sort of that anecdotal story of the person who is just eating less of food, maybe fast food or quick food choices, simple carbohydrates, things that are not necessarily the best fuel source in terms of, really meeting our long-term energy needs and eating less less processed carbohydrates or just same of the less processed carbohydrates is not going to be as supportive compared to a person who is eating complex carbohydrates and lots of fiber and emphasizing the protein. And so a comprehensive program is really going to be advising patients that they are adequately getting protein in. I think the most important thing with protein is that they're getting it throughout the day. So our body does not do a great job of storing protein. And so are we distributing that protein? Do we get it at breakfast? Do we get it at lunch? Do we get it at dinner? Is that something that we're consistently doing? Every time that we are having an eating opportunity, is there a little bit of protein that's included in that? Honestly important for any weight loss journey, but especially with these medications where sometimes the appetite gets turned down really pretty significantly, making sure that protein is the first priority is important. As we think about losing weight, we talk about losing weight, but the reality is you don't want to lose weight, you want to lose fat mass. And when I say that, every patient I talk to, client, who hears this thing is like, oh, yes, absolutely. And we agree with that and understand it. But then also, what happens in practicality is that a lot of people don't actually do the things that are in line with losing just fat mass and not losing muscle mass. So emphasizing protein, emphasizing resistance training can be really important, thinking about our movement in general. And so making sure that movement, even gentle movement like walking or yoga or activities that aren't even getting the heart rate up or anything, can be really important from a metabolic standpoint. And when we look at long-term weight loss success, some of those gentle exercises have really the best data behind them. But then also doing things like resistance training, which is so important from a muscle standpoint. And then especially for the peri and postmenopausal woman for thinking about the bone standpoint as well, not just supporting our muscles, but supporting our bones to reduce the risk of osteoporosis and osteopenia. I think there's been a lot coming out about, oh my gosh, people are losing muscle. And that is a worry. I think that is a concern that we need to make sure we're really supporting patients in trying to lose as much fat mass as possible while preserving or ideally even increasing their muscle mass.
Great. Thanks for all that. People who come to you obviously get a very comprehensive program. You really get to
Mhm.
do all the things and look at all these lifestyle issues. Some people get this medication from a primary care doctor who only has 15 or 20 minutes with them. And some of these people come to me to tell me that that's what happened. So you actually have a resource, though, to help people who are not in a comprehensive program that are just have a medication and aren't really sure kind of what to do from there.
Mhm.
Can you tell us a little bit more about that?
Yeah, absolutely. Thank you for mentioning. I developed a online program called the GLP Guide, and it's an online video series that discusses really all the frequently asked questions for these medications. It's ideal for someone who's thinking about starting these medications or as they're starting their journey, just that they feel they have that additional level of support of managing side effects as they come up, thinking about some of the nutrition or exercise recommendations, for example. The GLP Guide, right now we have about 60 videos and they're 5 to 10 minutes each. So they're very digestible material. Some are as simple as how do these medications work or what's a demonstration of how to use these medications. Others go through different side effects. Okay, if you're having nausea, if you're having constipation, if you're having diarrhea or sleep problems, we probably have 10 different side effects that we address. You're thinking about protein goals and how do I think about those? Lots of different videos to address those things. Because one of the things I was finding, I'm on social media pretty often, and I was getting people on TikTok or on Instagram that would send me DMs and say, hey, I've been dealing with really bad nausea. They've increased the dose. What do you think I should do? And I'm like, oh my gosh, why are you reaching out to me? I'm not your doctor. And while I'd love to be able to help those patients on a case by case basis, the reality is they're not my patient. And so, in protecting my medical license, I can't give personalized medical advice to people. So coming up with what are the recommendations for these things and then putting it out there in an educational way, it's been fun to be able to support people with that. And so I have that course online on my website. I think you'll include my website in the show notes, but it's just $97 for a whole year. So my goal was that it would be accessible, that really the average person could get that and get the information from that they need. And so it's been really fun to be able to support people a little bit more broadly in that way.
Oh, that sounds amazing. It's true. Sometimes you have a question and it's hard to reach your doctor depending on where you live and what your resources are. That sounds like a really great course.
Yeah. Thank you. Yeah, it's been really even just, the things you see on social media or you hear a news article or you see someone say something on social media and you're like, is that true? And, is that true? And, you know, you can hear a news article or you see someone say something on social media and you're like, is that true? And, is that true? And, you know, you can hear a news article or you see someone say something on social media and you're like, is that true? And we can find ourselves late at night and you're not going to find a great answer sometimes on Google. And so I really want it to be that resource of, okay, what are the questions? Do I have an answer to that? And one of the things that I've offered as well that's been really fun is for people who've bought the course, if they have a question that I haven't answered, I'm like, please email me and we will make a video and add it to the guide for you because I want, if you're having that question, other people likely do as well. And so we've been growing that resource over time as well.
Oh, that's really terrific. So they can go to your website and what if you can, I will have it in the show notes, but if you'll say out loud to what your website is.
Yes, absolutely. So it's sarahstombaughmd.com, SarahStombaughmd.com, specifically to go to the GLP guide. It's /GLP. And so you can find that on there, learn a little bit more about it, and purchase it if it's something that's in line with your goals.
Great. And I will remind people that they can see you in person in Charlottesville, Virginia, or they can, is it also through your website if they want to see you virtually?
It is, yeah. So we have information about the medical weight loss practice in there. Lots of great information. You can reach out. I do a free meet and greet with any potential patient because I want to make sure that they understand what my program is, what it isn't. I want to make sure that I'm prescribing for the right patient and that their expectations are in line with my goals. So I do that free meet and greet for everyone. So anyone who's interested in Illinois, Virginia, or Tennessee, I'm happy to do that. And that's all on my website as well.
Great. And on social media, is it by your name or what? How do people find you on socials?
Yeah, absolutely. So my podcast is Conquer Your Weight, and I use that same handle for social media. So you can find me at Conquer Your Weight or at Sarah Stombaugh MD.
Excellent. Well, thank you so much for being here today. You gave a lot of really great information, and I'm excited about the course that you have. That's going to be a great resource.
Yes, thank you so much. Really a pleasure to come on today. I really appreciate it.